African American health has been on a steady incline since the end of the Jim Crow era. In the 1960s and 70s, Black health started to improve significantly. Specifically, Black infant mortality rates began to decline between 1965 and 1970. Infant mortality rates are important to note when looking at overall health of a certain group because they are a great indicator. Black infant mortality rates started to decline because of the Social Security Act that established the Maternal and Child Health Service programs, which helped to reduce the rates of infant mortality rates in inner-city North and the rural South. Furthermore, Title VI of the Civil Rights Act of 1964 prohibited segregation in institutions receiving federal financing, which included public hospitals.
I am about to sign into law the Civil Rights Act of 1964. Its purpose is national, not regional. Its purpose is to promote a more abiding commitment to freedom, a more constant pursuit of justice, and a deeper respect for human dignity.
More funding for hospitals led to greater facilities and therefore better health for the Black community. Research has indicated that there were significant health differences for African Americans before and after the Jim Crow era, which was from 1959 to 2006. In fact, there was a convergence of Black infant deaths between 1965 to 1969 following the passage of the Civil Rights Act of 1964. Another aspect of Black health that started to improve during the 1970s was life expectancy. In 1940, the life expectancy for Black males was 52 and for women was 55. By 1977, the life expectancy for Black males was 62, but there was practically no change in that statistic 20 years prior. One of the main reasons for the fall in Black deaths was the control of infectious diseases. By 1977, there proved to be a correlation between the amount of education received by Blacks and how long they lived. In fact, Black males with 0 to 4 years of education had death rates 14% above the Black male average.
The Jim Crow era created racially segregated neighborhoods and facilities. A lot of all-Black neighborhoods still exist today and are some of the poorest parts of the country. These low-income cities and communities are most likely to have rundown public facilities, like hospitals and schools. In cities like Chicago, Detroit, Washington, D.C., Atlanta, Baltimore, and Birmingham, there are large numbers of all-Black communities. These communities emphasize on the color cross, which is the intersection between race and socioeconomic status. The color cross creates the conditions that lead to the substantial differences in the health profiles of whites and African Americans. The color cross is a modification of Du Bois's color line, which was segregation based on only race.
More bad news for the African American community, as the census reports the highest level of poverty for them since 1959. 27.4% of the country's 44 million Blacks, 1 in 4, earns less than $11,000 a year, what the government considers a bare minimum income to survive.
Poverty also affects the way parents interact and care for their children. Because of their low income, they have to rely on poor quality health care, overburden their family members, and oftentimes get more jobs to take care of their children. This means they cannot spend a lot of time with their children and have less influence on them in comparison to parents who have better jobs and more time to take care of their children. Fathers who have been previously arrested for felonies oftentimes do not have the means to provide financial support for their children and will not be allowed or choose not to participate in their children's lives. There is a positive correlation between poverty and crime, which has a profound effect on education levels and the number of people living in ghettos today. The urban poor show the interconnected context of neighborhood, work, and family in the Black community.
Poverty is still an issue which is present in today's society, especially for African Americans. Even until the 2000s, it's evident to say that Black poverty rates have not declined or improved remotely. African Americans have fallen into a continuous cycle of poverty due to discrimination, lack of economical opportunities, and failing public schools. This shows how there is clearly a lack of public awareness of this issue within America. The following images show what poverty looks like for African Americans. Now, looking at the first graphic from the article Being Poor, Black, and American, it shows the percentages of children living in poverty by race and ethnicity in 2007. It clearly shows that black children rank the highest at 34%, as opposed to only 10% of white children. Therefore, this proves that black poverty rates have not changed and are still increasing. It also demonstrates how the majority of African Americans are not being given any opportunities in order to have a manageable life. In result, this essentially puts them in a continuous battle against poverty. Now, shifting to the next source, Poverty in the United States 2012, it focuses on the poverty and its effects on the whole of America. Looking at this graphic, it shows the poverty rates in a time span of 5 years, from 2006 until 2010. It shows that amongst poor African Americans, 43.5% live in poverty-concentrated neighborhoods. As well, 22% live in extreme poverty areas, which poverty rates of 40% or more. This initially shows how African Americans are not seen as a priority in society. Altogether, it's evident to say that African Americans still deal with poverty in the 21st century.